All right, welcome everyone to the Will County Health Department Community Health Center. First, I do want to acknowledge our elected officials, which are here today. We have our Illinois Senator Meg Capel, who is with the 49th District. We have the Communication Director, Josh McCluskey, representing our Illinois State Representative Larry Walsh Jr. from District 86. We have Jose Villalobos on behalf of Senator Rachel Ventura from the 43rd District. And our county executive will be joining us later today. National Health Center Week is observed the second week of August every year. And it was started by and promoted by the National Association of Community Health Centers. And it seeks to celebrate the accomplishments within our communities and to spread the awareness of the importance of community health centers to promote our efforts in building a healthy country and to honor the work and dedication carried out by the health center staff in our communities. The community health centers in the United States play an eminent role in providing primary care and public health services to low-income, underinsured, and uninsured individuals. Community health centers are classified as nonprofit care centers operating under strict federal guidelines. And as a part of our country's healthcare safety net, we use federal funding to operate. Our President, Joe Biden, made a proclamation regarding National Health Center Week on August 4th, and I just wanted to read you a small snippet from it. Every year, our nation's nearly 1,400 federally funded community health centers provides critical, accessible, and affordable medical, dental, and behavioral health services to over 30 million Americans. Spread across every state and territory, these vital health centers help to make real the promise of health care in this country should be a right and not a privilege. During National Health Center Week, we celebrate their dedicated staff and recommit to providing the resources to keep these vital centers continuing protecting the well-being of the American people. This week, we thank the heroic health center staff on the front lines of improving lives. We acknowledge their sacrifice and courage, especially during the pandemic. And we are grateful for their daily work that saves lives and protects the future of this country. I'd like to reiterate the thank you to our health center staff, our dedicated, hardworking individuals. Our Will County Health Department Community Health Center was established in 1994 as a look-alike federally qualified health center. And then it was approved in 2001 and moved into this 33,000 square foot building in 2003. We are joint commissioned and we provide adult, pediatric, OBGYN, and family medicine, outpatient behavioral health services along with Medicaid-assisted treatment, family planning, a teen clinic, a prep and care clinic programs, audiology, eye care, health insurance enrollment, dental care, along with a mobile dental and mobile van, and coming soon, our on-site pharmacy, Genoa, will be part of our 340B pharmacy program. I just want to thank again the Community Health Center staff and thank you all for attending today. And I'd like to turn the mic over to our Illinois Senator, Senator Capel. Thank you.
Good morning, and thank you everyone for being here. It's a privilege and an honor to be here today to celebrate and to look at all the wonderful things that our Will County Health Department and Community Center does and is going to be doing, and to also honor, I know a special doctor that's been volunteering as well. You know, I have deep roots in Will County. My family has deep roots in Will County. In fact, when I was talking to Dr. I went to school with his daughter, and I think he was the doctor to one of my parents. So, I taught at Sanchez School, and I know how important we would send our students to the health department, for their shots, for their school checkups. And it's just such an integral part of what is needed and what a wonderful service it is for the community. So I am just here to say thank you. Thank you for all that you do. Thank you for your continued service to the community. And any way I can be supportive, my door is always open. Thank you.
Hi, I am Mary Maragos. I'm the Chief Executive Officer of the Will County Community Health Center. And thank you, all of you, for being with us today. And so I am here to celebrate Dr. Gutierrez. We had hoped to be outside, and we'll shift outside just for a bit afterwards as we dodge the raindrops. So we celebrate Dr. Gutierrez's 57-year career in medicine and his contribution and his dedication to the Will County Community Health Center. Dr. Gutierrez received his doctorate in medicine from the prestigious University of Illinois in Chicago and his residency training in internal medicine at Hines VA Hospital in the late 1960s. Dr. Gutierrez, being public health minded, went on to become a physician volunteer in Malawi, Central Africa, practicing tropical medicine in 1965. Later, he served our great nation in Vietnam as a captain in the Army in the 1st Infantry. In the early 1970s, he worked to shape the minds of the next generation of physicians as an instructor for the physical diagnosis course at Rush Medical Center in Chicago. Thereafter, in 1973, and to the great fortune of the Joliet community, he was asked and accepted the post of the medical consultant to the Will County Health Department. He was an instrumental part in the beginning of we called it the STD clinic, and also then the immunization clinic, and the development of the Community Health Center, which opened its doors in 1996. He then became the first chief medical officer of the Will County Community Health Center. He continued to provide expert care to our patients until his retirement in 2020. As a board-certified internal medicine physician, and with his expertise, in 1974, he became the chair of the Department of Medicine at Silver Cross Hospital. And in the mid-1980s, became the chief of staff at Silver Cross Hospital. Later, Dr. Gutierrez served as the hospital's chairman of the board and part of the discussions that centered around the current state of the hospital as it is today. So we're so grateful to you, Dr. Gutierrez. We have a plaque that we made. It is actually, the real one is in bronze that we will put down in the earth there. And this is what it says: in honor of Dr. Daniel Gutierrez, a founder of the Will County Community Health Center, our first medical director. Thank you so much.
Okay. May I say a few words? Well, thanks everyone for coming. First of all, let me acknowledge that throughout all these years of work, I've really enjoyed medicine, but fortunately, I've always had a very strong partner, my wife, Barbara. We've been married now almost 54, 55 years, and I have to say, of the many times I would come home late, she would always have fed the children earlier, and then she always waited for me with a very good warm meal and provided good companionship and solace, and heard all my stories of the day. So again, my thanks to my partner of so many years. This was a tree planting, so I was thinking about this, and I have a very good story to tell all of you. It's a very true story. My youngest daughter, Elizabeth, has 2 sets of twins, and over the years I've been helping her. And one day I was with her oldest of this first set of twins, Johanna. She was about 5 years of age, and so I was watching her, and we were walking outside, and of course, children being inquisitive, Johanna found this little acorn underneath this oak tree. She says, "Grandpa," she says, "what is this?" I went in to describe it. "Johanna, this is an acorn. Look at this wonderful oak tree. Look at how big and strong the branches are." And I said, "From that little acorn that you're holding there, when that's underground and you plant it, this is what happens. You get this kind of a tree." And she says, "Well, let's plant it, Grandpa." So I said, "Fine." So we cleared a little bit of leaves, and I made a little hole. We put the acorn down, and then she started looking at it. And after about 30 seconds, she said to me, "Grandpa, nothing's happening." So some patience was needed along the way. Let me just very quickly go into some of the history of this health center. The history of health departments really began with the study of tuberculosis back in the 1800s. And every time I come to this area, I never fail to remember that this was the place of Sunny Hill Sanatorium. This was a place where they treated tuberculosis back in the 1890s. It started here in the early 1900s. And of course, in those days, it hadn't been discovered until the 1890s that this was a disease caused by a bacteria. And in those days, of course, there was no antibiotics, but the idea was that if you provided patients with Sunny Hill, air, getting up on a small hill, fresh air, in an attempt to put them supine. And this had some physiological effects because tuberculosis is very common in the apices of the lungs, and so consequently, the patients benefited from bed rest and good hygiene. And of course, during this period of time is when the emergence developed, legislation began to occur around the country, and the indications being that, we have to do something about the health of people. This is a disease, as it used to be called, consumption, because people would get it, and so many would just die because of the starvation and weight loss. And this is, in fact, where the emergence of health departments began around the country. People began to acknowledge that, in fact, legislation was required in terms of doing things that would provide for proper environment, health care towards the population. So every time I come here, for those of you, and of course I had a lot of experience with tuberculosis when I spent a year working for the mission in Central Africa, but we don't see as much of it as we did here then, but and of course the history of the development of antibiotics is interesting. So again, going back to, as Mary mentioned, when I came back into practice here in the area, and they needed a physician to sign forms in the early 70s for, as a medical consultant, the outbreak occasionally of meningitis, writing orders for the veterinarians to get their shots against rabies, etc. And in those early years of the 70s, a lot of the activity around here was to some extent routine. Then, of course, we realized that we were having more patients coming and developing a need for treatment of the transmissible sexually transmitted diseases. And that's when I started coming here more often, actually every Tuesday and Thursday after my practice. We'd have clinics here from about 6 till around 8, seeing the sexually transmitted diseases in the community. As the population of the county began to increase, it got very busy, and at the time, I believe Jim Zelko was our director of the health department, and I said to Jim, this is getting to be pretty time consuming. And so at that point, we merged with and established a care with the Loyola Medical School, and they began to send some residents who are specialists in training in infectious disease to help run our clinic. Well, this was one area of where the health department now started to expand its emergence as far as the care of patients. Then we began to have a need as the population grew. We began to see that there was a need for kids for physicals to get into school and their need for vaccinations. Well, many of these patients had no insurance, or if they had Medicaid, they had difficulty accessing health care. And so that's when we began to develop an active vaccination clinic for children in this health department. And at the same time, we began providing school physicals for children before there's a requirement to get into grade school. It was shortly after that, and as Mary mentioned, I've had several positions in the community, and I was also president of the Will Grundy Medical Society, in which we had meetings of physicians of Will County together with Grundy County to discuss the issues confronting the community. At that time is when it became apparent that there was a great need for prenatal care. Many of the women who were pregnant in the community had no insurance, or if they had Medicaid, were having great difficulty in getting access to health care in the community. And when I was president of the Medical Society, we tried various programs, and the obstetricians would volunteer in terms of saying, okay, this doctor is going to see all the uninsured Medicaid for this month, this doctor will do the following month. And for the first couple of months, the program would work, and then eventually you couldn't get a third or fourth obstetrician to sign up for the program, et cetera. And it was during this time, again, with Jim, and we had a very active physician on the health boards at the time, Bob Kramer, who was an ENT physician, that we began to say, well, we're going to have to do something. We have a community here now where kids are needing physicals, vaccinations, and more significantly, we have this population of women who are having difficulty accessing medical care. And of course, we began a prenatal clinic here at the clinic, and where we would screen patients, those who were found to have hypertension and preeclampsia. We would refer them to high-risk medical centers in Chicago. Those who were diagnosed with diabetes, we began a program of treating them here, and then eventually the program, if they required insulin, we would have to get them to a high-risk center in Chicago. And it's at that time that I also initiated and began the diabetic center at Silver, because we found that there were so many patients with diabetes, they were not getting adequate care. And so we concentrated on a few nurse practitioners, developed their training programs to become certified diabetic educators, and the program, the Diabetic Center at Silver, is doing quite well. It was during this time, of course, that we had, I think Georgine Polyak was aware of these new programs that were starting around the country with regard to federally qualified health centers, lookalikes. And that's when there were a group of us who went ahead and began to sort of turn the wheel, so to speak, to try to get grant funding and to get approval so that we could become a lookalike, which we did. And then after that, you have to fulfill certain criteria for the federal government before you can become a full-fledged federally qualified health center. Through all this, I want to emphasize that there was just a great deal of cooperation. There was cooperation at all levels of members of the Board of Health, and going back to the executive directors that we've had back with Charles Edelman and with various Joe Micon, and then of course Larry, and now we have a new executive director. There has always been cooperation. Your health CEOs, Elizabeth and Jim, and you just don't go down to the county board of supervisors with a budget and say, sign it. There's a lot of accountability, and the work is not easy. But throughout all of this, we've always had excellent cooperation. And as I've always said, disease isn't a Democratic problem or a Republican problem. Disease is disease. It attacks everybody. So with this, of course, is when we began. And when we started our health center here, I can tell you that we had, and then at the time I was on the executive committee at Silver, and we had some interesting battles down there. Not all of the physicians wanted us to open a federally qualified health center. Some people said it was the introduction of socialized medicine to Will County, and we shouldn't have any part of it. At the same time, I was saying, well, look, here we have these patients. They're pregnant. They can't get health care. And for many of the women that were delivering in those days, the first time they saw a health care provider was when they went into labor, which of course was a deplorable situation. So really the real stimulus in which we had the cooperation of so many at all government levels. And I think, I was born and raised in Joliet, right down here off of Collins Street. And I'll repeat a quick story because I think some of you have known about it, but it's been really 103 years ago that my father and mother swam across the Rio Grande River and started working in the fields of Texas. My dad was 19, my mother was 16. And he came, a couple years later, a brother of his came, and then another brother came. So the three brothers came to the United States across the river. And then, of course, what happened after that was they were, eventually somebody heard that there was work at the railroads in Joliet. So my father came with his two brothers, and they came and started working on the railroad. When they worked on the railroad, and some of you may not be aware of the fact, but there was a tremendous Mexican migration throughout the country working for railroads throughout the United States. When the Depression hit, of course, then they started laying off many people across the country, and many of the Mexicans were given free railroad passes to return to Mexico. I think my mother was one of the most adamant ones who said, no, we don't want to return to Mexico. And so my dad, along with his two brothers and their families, were given jobs at the railroad, and they were given an opportunity to live in a boxcar. So our family moved into a boxcar. I'm the youngest of 9, and 3 of my siblings were born in that boxcar. My dad made $25 a month, and they described, the boxcar was, there was a pump, and I remember that pump because later on when I worked in the railroad myself, I went and looked at where their water source was, but they tell the stories of how there was one galvanized tub. They heated the water, and the first to take a bath was the eldest, mother and father, then brothers and sisters after that. The rooms were divided with sheets in the boxcars. I remember asking my mother, I said, well, how bad was it? She says, it wasn't all that bad because she had her two sister-in-laws there and right there to live with. And so, of course, eventually the depression receded and the family moved to Ward Avenue. Right near the prison is. One of the things that stands out, and which I'm particularly proud of my father and the brothers, is that in our family there were 6 of us boys, 3 girls, 6 boys. 5 of us served in the military. 2 served during World War II, 2 served during Korea, and I served in Vietnam. My brother, my uncle. Julio, he had 3 sons. 2 served during World War II. 1 received a Purple Heart. 1 served during the Korean, and the other uncle also had a son. So the Gutierrez family has been very honorable in serving its obligations. And when the opportunity came for me here to excuse me. Brings back lots of memories. But it's been easy for me to serve this population. I see faces that I've seen over the years, people that remind me of my family. And I would just say that Joliet has been very good to our family. I've tried to return the favor with my education and my devotion to this health center. And we've had a great group of people bringing this together. And again, I thank all of you who have volunteered and you legislators who have made this opportunity and this health center viable. And we've just got a lot of great people working here. I know you're going to carry on your mission. And there's a lot of stories I could tell about my experiences here. I have one story I remember when I was working, seeing patients, and family was in the room, and one of the, I think the young man had turned positive for HIV, and those were in the early days of HIV. We had very little medicine. And then the mother turned positive for syphilis, and they had a little child with them, about 3 or 4. And in those days, I think the easiest thing in the world for a physician to do is to write a prescription, give a pill, and say bye. But I felt at the time that's not going to solve this problem. And I said to the little boy, "You've got to make me a promise." And he looked at me. I says, you have to tell your parents they got to take you to church this week. I says, I don't care where you go to church. I don't care if you're Catholic, Protestant, Jewish, Muslim. It makes no difference. You've got to promise me your parents will take you somewhere this Sunday. And they looked at me and they kind of nodded. Because in those situations, which I think happens here with many of our patients, it's not so much that you're writing a prescription, but you're giving them something. And that's what happens, I think, with healthcare providers. When you're dealing with patients, you're giving something more than just a prescription. You're giving a part of yourself. And so I congratulate all of you who've worked here. I mean, the great work you did during COVID, the thousands of people we lost across this world, healthcare providers dealing with patients with COVID. And it's just a testimony to the greatness of the profession. And so I would say, I remember Jesse Jackson's words. Remember, he always used to say, keep hope alive. And I think that's what we all do. And it's not easy work, but it's rewarding work. So again, thank all of you for coming, and I appreciate your support.
Following the ceremony, a vanilla twist redbud tree located directly outside the front doors of the Will County Community Health Center was officially dedicated to Dr. Gutierrez.